Okay, welcome everyone. My name is Suki Steckel and I'm with the Center for Applied Research Solutions, and I'll be supporting this session as a moderator today. We're very pleased to offer this session to you. I'm very happy to welcome Dr. David Baker, the CEO of Sacramento Children's Home, Sacramento Children's Home. Yes, I had it right.
Sorry, on the screen it says SCH Family Programs. We
yeah,
use both.
I was getting confused with my notes. Sorry about that, Dr. Baker. I'll turn it over to you.
Oh, thank you so much. Yeah, so I'm David Baker with the Sacramento Children's Home, and sometimes referred to as SCH Family of Programs. Just quickly about the Children's Home and the programs we run. We run a variety of programs in the Sacramento region and in California, serving probably close to 8,000 youth and families a year. We run programs from outpatient mental health, wraparound, and TBS programs to a very small residential program. We have 2 crisis nurseries, 3 family resource centers, and some school-based programs, and urgent response programming. So we're going to talk a little bit about urgent response programming today. So the main objectives really are learning about the services available for youth in crisis in the Sacramento region, but also across California for current and former foster youth. And then hopefully have time to, I know a lot of people are implementing urgent response type programming, and we'll have some time to talk about some of the challenges, things that we've learned, and kind of explore and answer questions at the end. So we'll get started. We have a tight timeline. So first I'm going to start with what's called CalFIRS, or the Family Urgent Response System for California. And and maybe people are familiar with it, but it was really first enacted in 2019, finally got up and going in July 1st will be really 1 year since our official operating at full capacity for FIRS. We call it CalFIRS or FIRS. It's really serving current and former foster youth and their families. So it's really a coordinated statewide, regional, and county level system intended to provide support for kids and families that are in the system, or current or former foster youth up to age 21. So the purpose really is to prevent placement disruptions. The idea is to get some support to foster youth who are struggling in placements, and try to avoid and reduce having kids go into the hospital, having them move from foster families into congregate care. And for kids that have moved out of the system, it's to provide them some support of, whether they're in THP housing or that sort of thing. So who is served? Again, I mentioned we can serve any current or former foster youth, and there's a definition on here, and I'm sure you guys have access to the slides too, but 300, 601, 602s, that sort of thing. And anybody who's considered their caregiver. The caregiver definition can be a lot of different things. It might be a foster parent. It might be someone who's working with that child in a shelter, and sometimes even in an STRTP, or even just a social worker, of that sort of stuff. Whoever's really responsible for caring for that child at the time they are eligible to call as well. Things that were not intended by this service: it's not provided to assist locating new placements, and it's not intended to report child abuse, although everybody who works for our line is mandated reporters. It doesn't provide long-term therapy or other sort of supportive services. It's really just, there's a crisis that is put in, or some sort of urgent situation that could potentially disrupt placement. There's an option for calling. We can also take calls for folks that just need referrals for resources, or just want to talk to somebody. It's very varied. So we're contracted with the state to do the call center for the whole state, and we coordinate that with partners across the state. Sometimes it's a county, sometimes it's a provider that's contracted with that county. So we have staff that are trained in conflict resolution. They're a combination of professionals and paraprofessionals. We also have youth and parent and peer partners. They can provide a lot of support on the phone. They can also text If somebody doesn't want to call, they can text. So what happens when people call in is they're going to receive that phone support from one of our staff, and then afterwards they will also get a follow-up from us to make sure that they did get service that was helpful, or if they need additional support. So when they call in, if they're looking to have in-person support, it's not mandated, but if sometimes people just want to call and talk about some support, and other times folks need someone to come out in person. If in-person support is needed, we do what we refer to as a warm handoff. So our staff would make a connection to a three-way call to a local provider from whatever county they're in. So let's say they're in San Diego County, then we would do a warm handoff to the provider in San Diego County, and that provider, we would have a discussion with them about making a nice transition, hopefully in a way that doesn't require the person to completely tell their entire story over again, but in a way that is supportive and makes a nice handoff. And then that individual provider in San Diego would then arrange to go out and provide the in-person services. Like I said, sometimes depends on, every county has a different mechanism for who's doing this. So sometimes it's a county worker, sometimes it's a contracted provider. So there's a couple different things that are provided when needed or requested. One is an urgent response, which is generally within an hour, but not to exceed 3 hours, depending on circumstances. But usually the response in person is within an hour. A second level of response is if someone who's calling does not want an urgent response, but they might schedule one to take place in the next 24 hours. And that does happen a lot. So someone will call in, they're experiencing some sort of difficulty, whether it's the foster youth or it's their caregiver. They're not looking for someone to come out within an hour, but they would like to have someone come out, and they'll maybe schedule it for later that day or the next morning or that sort of thing. So that gets coordinated as well. So just an idea, okay, so this is the wrong slide. Sorry, I'm going to skip that slide. So the numbers of calls have been going up over the last year. I think early on in July, there was trying to get the word out was a big part of it to current and former foster youth. And so we were only getting 100, 200 calls a month. That has slowly gone up every month. The last several months, we're usually into about 300 to 350, and then I think we're already over 450 for June this month. So the good thing is the word is getting out to current and former foster youth about a line that they can call for resources. So some of the data that's collected by the state is always asked for folks. We do collect data on the placement type and the status. We do try to find information about how they were referred, what their current status is, and some basic demographics. We also, in terms of calls, we were talking about whether or not we track whether it was initiated by a youth or a caregiver and what's the situation. And then the counties, when they respond, then we gather the data on their response and track what happens in terms of placement stability, and is there any follow-ups that need to be done, and what was the timeliness to supporting them to permanency. Some of those details, the state is still working out how to track, but they're making some progress with that, but we do gather that data. So, like I said, we do a warm handoff to a mobile crisis response in the local system, and then each one of those systems has a single point of contact, and they have somebody who's available 24/7 to provide those face-to-face responses. So there's a lot of different ways that's done. Like I said, sometimes it's tacked on to programs like wraparound programs and that sort of thing. Sometimes they're standalone programs, and sometimes it's the county has it tied in with their other urgent response or triage programming. So it really varies a lot from county to county, and it has a lot to do with, honestly, with the size of the counties as well. So, and how many foster youth could be even calling from those counties. So the mobile response teams, they're really made up of multidisciplinary teams in each county. They generally can have anybody from a paraprofessional, like a mental health level person who has some experience, or they could be a licensed therapist. They could be working on hours, that sort of stuff. We have a variety of different levels of that occur. But teams definitely include youth peer mentors and family partners, and staff are trained in doing assessments and providing immediate crisis response if needed. So we every county also has set up, and we do as well, the ability to respond in multiple languages. We have some people on our staff who speak multiple languages, but we also have the ability for translation services. So, and each of the local providers do as well. So some of the responsibilities of those teams that are going out, the first thing is providing just basic in-home de-escalation, stabilization support. That can include going out and having face-to-face contact with the kids and with the caregivers. Can often include identifying underlying causes that led to the instability, trying to make a clear safety plan with the family, maybe observing interactions and making a determination about what would be helpful at the time, coaching with them, working with them, and generally we're expecting some level of follow-up after the de-escalation to some connection to some longer term solutions or some other mental health services that might be going on long term. So mobile response teams, they have they're going to do a follow-up generally within 24 hours to see if there's additional services that are needed, and there's a survey that's also sent, and the idea is for them really to establish connections, hopefully connect to them some community-based support, and really identify if there's any existing CFT or behavioral health treatment plans, and try to coordinate those responses. So that's done at each of the county level. But the idea is two parts about that. One is that they'll get some immediate service, and then they will get connected back to whatever service they already have. So if they already have a local provider, and we'll help coordinate that. If they don't have services, then there'll be assistance coordinating, getting those connections. But one thing that's been tried to make really clear is that these should not be cause for placement disruptions, meaning that accessing and having people come out to help stabilize a situation is really intended not to indicate that there's some sort of problem in the home, and that maybe they should be looking for a different placement. The idea is actually to stabilize that placement. So some of the data that's collected and shared is at the state level is very specifically not necessarily shared out to everybody other than those that really need to know, sort of thing. So it's not sort of many advocates and youth were concerned about, does this look on my permanent record like I was having a problem, or it's going to affect my ability to move forward with another placement, that sort of thing. So there's been a lot of effort to make sure that only pertinent information is provided that way. So, okay, so after there's a visit, there is a summary report that is sent to us, and it goes to the state. It includes plans going forward and is intended to use for linkage of ongoing support services. That's the main purpose. Some of the key messages, like I was sort of referring to, which is reaching out is a sign of strength, not necessarily a problem. We want caregivers to know that they're not alone, and that there's services out there to preserve placements. The reality is that kids are going to be in placements, they're going to have struggles, and those folks are going to need support if we want to make sure that the kids, that we're able to stabilize kids in solid placements. So these services are there just to assist. It can be a crisis. The crisis is really different for everyone, so that's really important to call. We've certainly been out on what would be considered high-level serious crisis situations where we're even concerned about safety. And then, of course, we've had others that are just minor disruptions, but being able to be there and provide support to families is very supportive. So it can be across the gamut. And if an in-person visit is requested, then it's provided regardless of the level of severity, so to speak, of the issue. For kids, we want to make sure they know that there's support for them and that it's judgment-free and safe. We do have youth that just like to text our staff and talk to them about what's bothering them. They're not looking for anybody to come out. They just need someone to talk to. That happens often. Sometimes they'll call and do the same thing. I have the data here, but the data that I had up was actually from the first quarter of last year. So, and to illustrate my point about sometimes folks are just calling to get support and talk to somebody, we're running probably about 27%, I think, is the most recent data of actual in-person responses of the number of calls. So for every 100 calls, we're only dispatching somebody out about 27 of those times. So that kind of gives you an idea that it's only about a fourth of these where people really need someone to come out immediately. A lot of times they just want to get connected to services, or they just want to get a referral, or many youth just want to talk to somebody, and they have once they've discovered that they can call and talk and there won't be judgment. There'll be people, and we have peer mentors and that sort of stuff. They tends to that we do have some folks that like to call back. So in order to get the word out, there is a lot of local outreach that's been sent out to every county. Every county has gotten flyers and different things. We have a website. There's some social media stuff that goes out, and we're trying to get as much word as we can out to any place that is serving current or former foster youth, or places that they would be and go to provide support. So, and also on the CalFIRS website, and there's the calfirs.org. These state flyers are available, and you can print them and give them out. Here's the one for youth. Here's the one for caregiver. We discovered today that they actually don't have the ages on there. So the ages for these is actually up to age 21. So that's important. And we just messaged the state today to let them know that their flyers actually are missing that age range. But keep in mind that we do have folks that call that are not eligible, that are current or former foster youth that are over age 21. We do provide them all of the same phone support and text support and referrals. We just are not able to do a dispatch of in-person. So, and we do have several folks who call and just, they might be 23, 24, and they're still calling and getting support. We just aren't able to dispatch. So, okay, so that's really the statewide urgent response system, the short version of it, for all current and former foster youth. And I mentioned that every county has a different system to provide that support for our warm handoffs. Here in Sacramento, we run a program that's called The Source, which is the program that will respond when when a current or former foster youth calls for support in Sacramento. And so, but in addition to providing support to current and former foster youth through the CalFIRS up to age 21, The Source actually can provide the same support that I was just talking about to any youth in Sacramento County up to age 26 or their caregivers. When we first started the program, it was about 4 years ago, it was designed to be just for current and former foster youth, just like the CalFIRS was. But what we found was once you start up a program, and so when we talk about the difficulties of for anybody in a county who's getting started on providing more urgent responses, providing 24/7 care 365 days a year, means that you have a lot of staff that are available to answer these calls and to go out in person. And you have different levels of people and that sort of stuff. So working with the county here locally, we discovered that if we limited that just to current and former foster youth, then there was more downtime than we would prefer. And also, we found that there was a lot of kids that needed support regardless of that status, and they would still call. So, and so we actually expanded the program out to include all kids up and caregivers up to age 26. So that was done by bringing in dollars, a combination of dollars, MHSA dollars, Mental Health Service Act dollars, and there was a work group that included all of these folks, including folks that were from CASAs to behavioral health folks to youth advocates, family members, CPS, and probation. The idea was to say, can we build something under MHSA that would provide support to the whole county when there's some sort of crisis or that sort of need? And so just like the CalFIRS, anybody can call the source and they can get the same sort of up to age 26 for their caregiver. They can get support on the phone or they can text. And then we can also dispatch usually within an hour to anywhere in the county to provide in-person support. So the MHSA planning process led to this, saying we wanted to have 24/7 mobile services. We wanted them to include advocates and family members, and we wanted them to be able to provide follow-up services. So when we do get a call, we're able to link them often to local providers, whether they need mental health services or that sort of thing. But what's unique about the source that's a little different than CalFIRS is that if we open them up, we can stay with them for up to 60 days if necessary. So we can keep seeing them until we get them linked, because sometimes that linkage process takes longer than we would all like. So, and rather than drop them, we just keep working with them on a short-term basis. So, and that's done mostly through the MHSA funding, but we do have access to Medi-Cal dollars for especially mental health services as well. That always comes up. So, some information about what we know about kids about foster youth is that placement instability has a large negative effect on kids, and it causes kids to move from home to home, which tends to get them behind in terms of education, and it usually leads to significant other challenges. So the system was originally designed to support those youth and make sure that there was not as many placement changes. Some of the stats that were from Sacramento at the time when the program started was the number of kids that we had in foster placements and how many of those kids were not linked to the mental health plan. So one of the goals was to really get as many kids linked as we could. And again, started with foster youth, but then moved to just trying to get how many of those kids can we get connected to mental health plans even beyond the foster kids. So like I said, like I said, they just like on the CalFIRS, you can call or text, and actually you can go on the website and do a chat as well if you're over 13 years old. So, and it's just 916 support that works for calling and texting. So, who's eligible for the source is kids and they're under 26, and caregivers work with those youth, and they have to be in Sacramento County. So, some of the goals were to, again, maintain placement for those kids that were in placement, increase coordination of care with other system partners. Sacramento does a really nice job of having multiple options for mental health services, in different varying degrees of intensity, but sometimes connecting folks and making sure that people know which one makes sense and how to kind of manipulate the system to get into those services can be difficult for folks. So one of the goals really was to help coordinate and partners working together and making sure that the kids and families were getting connected prior to having to be hospitalized, prior to having to go to the mental health clinic, and certainly prior to any law enforcement having to be called out and utilized for 5150s or that sort of stuff that we're really working on avoiding. So some of the crises that we see, youth expressing danger to self or others, youth destroying property, parent, caregiver having difficulty managing youth, caregivers ready to give up. The source is also a little bit more unique in terms of, in addition to the urgent response, we plan monthly activities because even though we can work with all youth, we still have a focus on current and former foster youth. So we do monthly activities with the idea of giving some level of respite to those families. So those have been more difficult during COVID, of course, but prior to COVID, we were doing a lot of drop your kid off for the day, and we had a lot of activities and sort of thing like that. So those were really designed to give a break to foster parents who have very demanding schedules. We were trying to avoid kids being kicked out and experiencing homelessness. We do get calls from homeless youth, and we have access to funds to help support them as well. Getting into, especially transitional age youth, it's not uncommon for us to utilize hotels for transitional age youth while we will look for some more stable housing for them. So another thing is a response is to violent and aggressive behaviors, that sort of thing. So, okay, types of services and intervention. We do provide coaching. We provide teaching of coping skills. We do create safety plans with families. We can provide respite and breaks. Our respite's really not overnight, but we definitely can provide respite for families under circumstances where that makes the most sense. And what we have found is sometimes that respite is, taking the kid for a walk and talking to them and getting a little space. Sometimes it doesn't even have to be that long. We do provide referrals and resources, and we have peer support counselors that can do follow-up as well. Same thing applies to caregivers. We can provide coaching, teaching coping skills. We can provide intense short-term support and referrals and that sort of thing. And going back to the CalFIRS, and many of the counties have similar setups, so that when a current or former foster youth accesses the CalFIRS and we do a warm handoff to a local county, those service providers often bring other services as well. So there's a lot of overlap a lot of times. Again, I mentioned referrals and advocacy, youth activities. We do have youth activities that we do that are for current and former foster youth. And we do a lot of coordination and linkage for providers. Locally here, we also, we have access to, when a youth calls in, we can find out what we can access our local system to find out who if they're already linked to a provider and who that is. And then we can also access and make sure that there's a connection back to that program. So that what we found is sometimes in the middle of a crisis, they'll maybe they already have a safety plan, but they forget about it. And so we can access the other providers and make sure that they're linked right back to them and that there's no delay in that. And we can also sometimes remind them of what number to call. We can try to help set up an appointment, that sort of thing. So we have different kinds of staff at the source, and it's the same for CalFIRS. We have what we call on-call coordinators. Those are MHRS or MHA level. We have clinicians, we have youth partners and family partners. And so usually when we're getting ready to go out for an in-person, it's some combination of those folks, depending on what the need the youth and families and what they've expressed. So we do have a youth advisory board that meets regularly to try to make sure that they're helping us. A lot of times we have these so-called great ideas, all of us adults, about how we could help support the youth. But what we found is that actually having the youth advisory board has actually helped shape a lot of our intervention approaches to kind of be more in line with what folks are looking for. So that's been very helpful. And they also gives them an opportunity for kind of being involved in planning some of the activities and some of the responses and things that we haven't thought of. So, all right. Well, I'll go back to questions now. Questions and discussion. So.
Thank you so much, Dr. Baker. We welcome everyone to go ahead and keep placing your questions in the chat, and we will track those and get to them. So it looks like we have the first question is, does the target population include former foster youth who now have become an adult?
Yeah, so two answers to that. So under the CalFIRS, which is the statewide support for the current former foster youth, it's up to age 21. So when they turn 21, they're no longer eligible. I will say that that number was set by the original legislation. There's a lot of efforts, and we support the efforts to actually expand that out to 26. So I would not be surprised if in the next couple of years you see that number continue to grow out past age 21. Now, locally, we can go up to age 26. So we capture in Sacramento County, we'll capture all of those youth up to age 26. We all know that 20-year-olds aren't always ready to move on without support from others. I'm not even sure 26-year-olds are, so but definitely not 20-year-olds.
It definitely depends. Okay, So we have another question, which is, are there data for FERS calls for the state of California, as well as the number of calls by counties?
Yeah, so we're averaging, so in the last 6 months, we're averaging between, I don't know, I'll say close to 400 calls for the state each month. And so the data has not been, the state hasn't released per county data yet, but they're working on that. So we work with the state, we provide some data to them directly, and then of course they collect data from each county on, so after a county has a call and they go out and have a visit, there's a little form that they fill out and that they send back in, and that form gives them some real basic information. They're starting to accumulate that data, and I'm anticipating that the state will be providing county level data soon, but we've been turning over all of that data to them, and we've certainly been sharing statewide data that we've been authorized to share. So when we started the program, you know, and many people on the calls may have been involved in a lot of these because it goes back a few years, and we had a lot of stakeholder meetings and that sort of thing. We had a gentleman come from a very similar program design in New Jersey, where they had been implemented a FERS program as well. And he was very clear that from his perspective, it took 5 years before it was completely integrated into the full system to where people were actually fully utilizing it. So based on that and the fact that California is a lot larger in terms of population, and we're a little more complicated because of all of our counties as opposed to state-run, I would imagine it will be at least 5 years before we see you know, it being really fully integrated into systems across every county. So I anticipate those numbers continue to go up.
Can you let us know if the flyers are available in other languages, and if so?
They are. That's a great question. They are.
Yes, thank you for that question.
And on that website, I think they're available and they are definitely available in multiple languages on that CalFIRS website. and then the state is working on actually adding even more languages. So I can't remember the exact number that they have posted, but I think it's at least 4, but I could be wrong, but I know they're working on having even more of them done.
You mentioned the website. Is that something that we can share, or is it in your slides?
Yeah, I think it might have been in there, but yeah, you certainly can share it.
Okay, we'll take a second and
so here's the number, the 1-833-939 FERS or 3877, and it should be, I believe it is calfers.org. So if you just search CalFERS, it'll actually show up, because there's 2 websites. It's a little confusing. There's the CalFERS website that we operate, and then there is a state one that talks about the full implementation of CalFERS. But it, yeah, so right here is the CDSS info source where you can get the CalFERS, but the calfers.org is also just the easiest way. And there's a link on calfers.org over to this site where they have all of these flyers. So, and they'll also, there's also a way on that website when you click over, they have things like, they'll send you these magnets. The state will send them to any county who requests them so they can distribute them. They'll send you these. There's a way to request those. And you can also, I believe, request flyers that are actually printed already too, to have them mailed out to your organization or to your county. So, you know, I know there's folks there's a lot of programs that are getting started to have some urgent response. Just, I think when folks get going, it's just to remember, if you are starting a program, that 24/7 is a lot of staff. So one thing that was helpful in Sacramento County is we started with just current and former foster youth, I think up to age 21. And then we sort of grew that to all youth up to age 21. Then we moved it out to 26 because as calls started going up, we were bringing on more staff. And so it's really been a balance. Even on the statewide side, we, you know, as the calls keep going up, we keep adding staff. Now that has been, you know, of course, challenging during COVID. So I will say this about, because people always didn't bring up today, but it comes up a lot of times around safety screening and that sort of thing. So on the CalFERS side, when we do a warm handoff, there is some basic safety screening that the providers do. So they might ask a few questions about, you know, weapons in the home and that sort of thing. And during COVID, they've asked about COVID symptoms and that sort of stuff as well. And we do the same thing in Sacramento. We try to make some level of assessment of the safety and before we send staff out, and that'll also might dictate how many staff and which staff we send. And we also do some basic screening around COVID still. And our staff do go out still with masks and that sort of thing because, you know, COVID's still here. So, but there is a little bit of that question comes up sometimes, that there is some level of safety. So we don't send people out into, you know, in the middle of the night to a location without doing some level of screening. And we always have all of our staff. The number one thing is to make an assessment about their safety, and that sometimes determines what we can and can't do. So I think that's important that people understand. And we've even had situations where we've met people in different places because they were openly upfront about it not being a safe place, you know, that sort of thing.
Can you share some of the kind of trends that you anticipate seeing with the type of calls that you're getting over the next year, and anything related to how you're going to kind of attempt to address those? Either, you know, programs.
The trend that's actually been one that that we've seen happening more and more, which is foster youth across the state who have someone has shared with them the number, and they're starting to use the number to call. And then that has, while the intention of the thing was to preserve placements and prevent kids from going to, say, congregate care, so an STRTP or a shelter situation, what we have noticed is that those kids carry that number with them, and we've seen an increase of calls from congregate care settings. So that's required us to kind of work with the local providers and the partners that we're doing the warm handoffs with to figure out, how do you do that? How do you coordinate those services in a way that the youth feels supported, but we're not undermining either? It's a tough balance, and we saw that start to happen. And I guess it was logical from the perspective of, once the kids have used the number and have been connected when they were not in congregate care, that they would still carry that forward. Many of them have them in the numbers in their phones and that sort of thing. So I anticipate that will keep happening as youth. If youth found that they were supported, then they're going to call again, regardless of what setting they're in. So that's something that's happened. And then, of course, we've we see it a lot on the source side. So on the Sacramento County specific side and I think it will continue to be an issue here in Sacramento and certainly across the state. We continue to see youth that are struggling, transitional age youth that are struggling with housing. So I anticipate that we'll have to continue to do work on layering what our services are available and our connections, and sort of how do we connect folks to housing. Like I said, we have the ability for kids that are 18 and over, we have the ability to put them in a hotel for short stays, but trying to find housing programs sometimes means the hotel's not a short stay. So I think that's going to continue to be an issue, at least locally, and I imagine across the state. So really it's about educating our staff on what services and are available for those youth. And we've also locally here, we've partnered with some hotels that have been supportive of us putting youth there. Sometimes hotels struggle because they don't want someone to come in unless they have a credit card and an ID and all of the other sort of things. So we've been able to set up a way that we can do that for them. And I think that's going to be a growing need for some of the transitional age youth, both current and former foster youth. I mean, both foster youth, but also non-foster youth. So, and I know a lot of urgent response programming is starting to pop up across the state that's not just for foster youth. So, and it's definitely an issue that we're all seeing. Something that we have started to do as well, which I also think is going to be an issue, we have started to train our staff and provide them with Narcan to carry, because being out in the community, working with this population, the chances of coming across a situation where that would be necessary, where someone could potentially be overdosing, is very high. So I think that's going to be the more folks that get trained to do that, it's not complicated, and have those with them, the better. So we're definitely seeing a need for that. Thankfully, we haven't had to use it, but we know it's out. The need is out there.
This is really important information, and I'm so glad that all of you could join us